all patients in Nebraska that are having spinal surgery or have had any type of bone injury that needs to heal, they need to be on vitamin D. My name is John McClellan. I'm a pediatric and adult spine specialist at the Nebraska Spine and Pain Center in Omaha, Nebraska. My experience with vitamin D 16 years ago when I started in spine surgery, we paid no attention to it. When we noticed that the boys and girls weren't healing their fractures, and after visiting with Dr. Recker, who's a bone specialist in metabolism at Creighton, we identified they needed to be given vitamin D to help healing. That's completely transformed how we take care of stress fractures, as well as adults that have spinal surgeries that require bone healing. When a good parent goes to the store, you always buy the calcium plus vitamin D milk. The amount of vitamin D in that calcium is completely insignificant. It has absolutely no benefit to patients, and that's my opinion. And surprisingly, the federal government says that you should take 400 units of vitamin D. We actually tested that. We gave boys and girls 400 units of vitamin D. We tested their lab work 2 to 3 months later, and we found that their vitamin D levels didn't budge one iota, didn't change. And we found that you had to use fairly high dose vitamin D to see a change in their blood work. And that's my advice, 1,000 units a day. And for most adults, I think the appropriate dose is somewhere north of that of around 4,000 to 5,000 units per day. If you put an adult on vitamin D, the actual size and strength of their thigh bone, the thickness of the wall, dramatically increases. Now, if a vitamin D can do that, it's doing a lot of other things in your body. If you'd like more information on vitamin D and the research we're doing, there's more information on our website.